It's now 2 weeks, just 14 days to the inauguration of Bola Ahmed Tinubu as the 16th president of the Federal Republic of Nigeria, and we're counting down. Thanks for joining us on the program. I am Nifemi Oguntoye. Remember, you can join the conversation right now online using the hashtag Inauguration Day on Twitter. Our attention today is turned to Nigeria's health sector and what the incoming administration must do differently. A good place to start is asking how much Nigeria spends on health. A breakdown of a 3-year budget between 2019 and 2021 shows that 6,000 naira 534 was budgeted for each citizen, indicating just about 2,000 naira per citizen in a year. Nigeria's health sector got 4.7% of the budget in 2019, 3.8% in 2020, and some 4% in 2021, as well as 4.5% in 2022 fiscal year. The sector got its highest allocation in 2023 at 5.75%, but that still falls short of the Abuja Declaration threshold. The implication of this is that government expenditure for health is only 25.15% of all the money spent on health across the country. And of the percentage spent on health by citizens, which is 74.85%, about 70% of it is spent as out-of-pocket expenditure to pay for access to health services in both government and private facilities. So you can imagine the economic burden on Nigerians to ensure that they get their health in the right place. And while Nigeria suffers some insufficient number of doctors and has a doctor-patient ratio of over 5 times worse than the WHO recommendation, the country still loses hundreds, if not thousands of doctors annually to brain drain. A large number of them, of course, to the UK and the United States. So as the new administration to be led by Bola Tinubu gets underway by May 29, what must he do differently? When the program returns after this break, I'll be joined by a professor of virology and a professor of orthopedic and trauma surgery for more on this development. Stay with us. We are counting down to when Bola Tinubu will take over mantle of leadership and what he must do differently where Nigeria's health sector is concerned. I'm joined now by Professor of Virology and former Vice Chancellor of Redeemers University, Oyewale Tomori. Thank you, Prof, for joining us on the countdown. Let's begin with the budgetary allocation to the health sector in Nigeria. 22 years after heads of state of African Union countries met in Abuja, committing to prioritize the health sector by allocating at least 15% of the annual budget to the sector, we're still in between 4 to 5% in Nigeria. What do you think is the problem?
Thank you very much. I think we have a series of governments that have not really cared much about health for the people. It's point blank that, like you said, it was in Abuja they decided they were going to put 15%. We've never even reached 1/3 of that all these years. I think it's a reflection on a government that cares very little about the health of its people. Simple.
Well, but government also has an explanation. In 2020, for instance, the permanent secretary of the Federal Ministry of Health, Abdulaziz Abdullahi, was quoted to have said that the 15% budget for health is an aspiration and a set target that the country wishes to attain. And according to him, it is dependent on a number of factors. For instance, the competing interests from different sectors like education, agriculture, security, among others. And this means the government must prioritize based on available resources. Prof, do you agree that this 15% allocation can't be made independent of other economic indices and available resources?
Well, one important thing you said is an aspiration. So you aim to achieve it. But when you're not even making efforts to go to it, then, I mean, what is the aspiration for? If you make up your mind, I'm going to do this, and you never even attain 1/3 of that, it means you're not serious about your aspiration. That's number one. And I hear people talk about competing interests, and they say Greek and that. The greatest competing interest we have in Nigeria is not all those things. It's corruption. It's self-interest. Even the little that is allocated, how much of it gets into the health? It goes into people's pockets. So when we are talking about competing interests, we should be careful. The major competing interest for our problem in Nigeria is corruption and not all those things we're talking about. Let's resolve that, and we'll probably have some substantial amount of money, ready for whatever it is we plan to do. Go and check your records. What illegally leaves Africa is 10 times more than what the aid that we get. So we're begging our leaders, if they can only just steal 80% and leave the 20% for us, you see a difference in the life of our people.
Corruption is a big topic to tackle. What exactly are you recommending that the incoming administration do differently in this regard?
Accountability and transparency. That simple and simple. Corruption starts with the individual. I use the word self-interest, over national interest. If that individual sees his nation and does what he needs to do for his nation, one by one, it is a accommodation of the self-interest that destroys the national interest. If I'm in a position of authority and I misuse the money, the next person does that, the next person does that, then the entire nation is in danger. So it has to start from each and every one of us. I mean, I'm sorry to be that blunt, but the actual fact, when you look at a man enters the civil service at the age of 25, he leaves at 60. In between that time, he has had 5 presidents, 10 ministers, and things haven't changed. Is it the people who are leaving that are causing the problem, or the people who are remaining? I'm not blaming all civil servants, but the majority of the problem we have in this country, until we face those things, are those civil servants.
The challenges, we've been talking about this for years, so I'm looking at how much impact it will have. Are you looking forward to a situation where, if corruption is dealt with, the number of resources will increase and they will have money to share that will impact positively on the health sector?
Let me tell you, corruption is not, Nigeria is not really a country that have corruption. Every country, I mean, US, UK, whatever. But the people are be sensible about their corruption. They think a little about, the people they are serving. Here, you find the people that is only themselves they think of. And that's where we are today.
All right, let's talk about brain drain in Nigeria's health sector. And, the reality here is perhaps why we see many of our health workers leaving the country in drove. We hear that as of 2020, close to 4,000 Nigeria-trained doctors are licensed to practice medicine in the U.S. In March this year, the figure has risen to 11,000 in the United Kingdom. What's happening? What are the direct implications also on the sector in Nigeria?
With a continued brain drain, our health sector will continue to drain into nonsense. That's what is going to happen. And when we talk about brain drain, let me say one thing. The basic issue about draining is the environment in which we practice our health. Create an enabling environment for people and they will stay. Let me give a good example. My generation, we never left, not because we didn't want to leave, but the enabling environment in Nigeria was so good that people like us and my generation stayed. We developed, we served in our country. We had fulfillment of our professional self-fulfillment, and we were able to live a decent life. And so you stay. That's the basic thing. All these people who are going out, you think they are going out because they love those countries. Go and see what they are suffering over there. It is because the environment they're working is not enabling them to function well. That's all. Improve the enabling environment. Those in the diaspora will come back.
On a like note, Prof, you said your generation never left, but you're speaking with me from Atlanta. I hope you have not jacked by yourself.
Hey, Nick, I just came here to see my grandchildren. If my children are in Nigeria, do you think I will come to Atlanta? What am I going to do in Atlanta? Well, what am I coming to do here? Because the country didn't enable my children and grandchildren to stay in Nigeria, that's why I'm here. For me.
That's reassuring. So let's talk about the implication of this. They say that Nigeria needs to produce about 12,000 doctors annually to be able to meet the required number of physicians. But according to the president of the Medical and Dental Consultants Association of Nigeria, Dr. Marco Jola, is saying that 9 out of every 10 medical and dental consultants with less than 5 years of experience plan to leave the country for greener pastures. Just last year, 7,200 Nigerian nurses were registered with the Nursing and Midwifery Council, Britain's professional body. We're hearing that our country is only, thought to Philippines and India, with more nurses in Britain. What do you think is the role of the level of patriotism that you have talked about in your generation that is not found this time?
There is a limit to patriotism. Let me be frank with you. You know, people quote John Kennedy. They said, "Do not ask what your country can do for you," and or whatever that thing. Before John Kennedy said that, his country has already done something for him. Go and find out his life history. When he was caught by the enemy, his country went out to pick him and to save him. That is what the first starting point. Your country must do something for you before you begin to do something for the country. A country that has not done anything for you, it's not existing. And that's the situation that we're having in the country. First of all, that country must do its own duty. It's a reciprocal thing. It's not a one-way thing. And we are talking about the training. Yes, the more we train, but the more that go out because we allow them to go out, because we make a country so unconducive for them to go out, we can train more and more. The balance is how many remain. And if you don't improve that environment at home, you can train thousands, but 2,000 will go.
I'm wondering what
the home environment, and then we can have no problem with that. People will still live, but the balance that we live with, they're not for our needs.
I get you, Prof, but I'm wondering what you think about the culpability of these other countries, because Nigeria, for instance, has been on the WHO list of countries with a shortage of healthcare workers since 2020. And, foreign employers are discouraged from recruiting nurses from the list, of course, two-thirds of which are in Africa. So you're wondering, if there are no places to go, are we not going to be first to fix the situation back at home? Don't you think countries like the UK is culpable in this regard?
Let's stop blaming people outside for our problems. Our problem has been there from time immemorial. We have not created the environment. They're living and they're living because the situation has continued to be that. Those people, you can stop them. They will find other places to go. You don't have to go to Britain or other things. There are the other countries that will take them. All these things we're talking about. Why are you asking for culpability of India or Britain when you are not taking care of your own people? No, the first thing is take care of your people. When people go across the Sahara Desert and go and drown in the Mediterranean Sea, whom are you blaming? If the situation is so bad for them to go through those things, the thing you should be looking at is back home, those things at home that is making people to risk their life to cross the desert and go and drown in the Mediterranean Sea. Something must be wrong with your situation at home. Repair that first before you start blaming other people.
You're saying that we must look inwards to solve our problems before blaming outsiders. However, lawmakers think differently, Prof. There's a bill now before the House of Reps seeking to prevent Nigerian-trained medical or dental practitioners from being granted full licenses until they have worked for a minimum of 5 years. But we're going to take a short break, and when we return, we'll talk more about that. Prof, please stay with us. Thanks for staying with us on the countdown. We're looking at the health sector ahead, the incoming administration and the efforts, what the Tinubu Presidency must do differently. I've been speaking with former Vice Chancellor of Redeemers University, Professor Tomori. Thank you for staying with us on the program. I'm also joined now by Professor of Orthopedic and Trauma Surgery. He's also Pioneer Provost of the College of Health Sciences at Ahmadu Bello University Teaching Hospital, Professor Mike Ogirima, who is also a former president of the Nigerian Medical Association. Great time for you to join us, Prof. We're just talking about the reasons why Nigerian health workers are leaving the country in droves. And Professor Tomori said that Nigeria must look inwards rather than blame, people on the outside for its problems. But I wanted to speak very quickly to the proposal by the House of Reps seeking to prevent Nigerian-trained doctors and dentists from being granted full licenses until they have worked for a minimum of 5 years in the country. Do you think that will work?
That proposal is dead on arrival. For somebody to sit down and think and imagine that you can keep a professional or somebody educated, not to practice fully for 5 years, it is unheard of.
No, not saying. The proposal is not saying they will not practice fully. It's just saying that practice will be within the country. Isn't that what it's saying?
Yeah, I don't know. What he is saying is that if a doctor qualifies that doctor should not be licensed fully to practice. How do you practice without a full license? You can't practice. That is quackery. If you allow somebody without a license to practice, it's not heard of. The 1 year after graduation that a doctor spends as a houseman is a stage of, training on the job. So that after 1 year, that person can be certified to practice on his own. So if you deny that person for 5 years, it is criminal. And that person thinking like that should be treated and should be sued by the court of law.
And this represents the position of the Nigerian Medical Association, I suggest, right?
Yes, that is our position.
All right, so let's quickly get back to Prof. Tomori. I'd like us to speak to the resolution of labor disputes between government and health workers. Just 2 days ago, Johesu and another body issued a 15-day strike ultimatum over what they call alleged inconsistencies by the federal government in the ongoing negotiations to adjust salary structure and the rest. But look at the figures, Prof. Since the start of the pandemic in 2020, doctors have been on strike for not less than 4 times, including sometime in August 2021, that the National Association of Resident Doctors were on strike for more than 20 days. Speak to us about the ethics of it. Should doctors even go on strike for any reason whatsoever, or for as often as they have that we have experienced in the past few years in Nigeria?
Thank you very much. There are conditions for ethics. When you talk about ethics, there's something you have to do on my side and something I have to do on your side. You cannot take only your own side and say, I'm not ethical. There are conditions. You tell somebody, do not defecate openly, and then there's no toilet to defecate. How do you get not to defecate openly? So let's be frank with each other. When government fails to meet its condition, then you start shouting about ethics. No, you can't. I know what my friend, he was more on his side about hypocritical, but there's also basic assumptions that must be in place before you start bringing all those issues. You cannot, I use the word disenable a person, and then you tell him he's not functioning. How can he function? We are not providing those bases for him. Of course, the issue of strike is not just for the medical people alone. You know our universities have been on strike for how many years? Virtually everywhere. And it's a strike of strike. Everybody is striking. Something must be wrong with the people they are striking against. I think that's where we should be looking at. What is it that is leading to everybody asking for strike from teacher to road worker to something? The common factor is that we are leading with a government that is not performing its duty to ensure that the right conditions are available for people to function.
I hear you, Prof. Professor Ogirima, you have sat on the table with government as a former NMA president. Talk to us about how the incoming administration can reach an agreement with health workers in this new dispensation, given what we call the nation's scarce resources.
Well, thank you. The government of Bola Ahmed Tinubu, based on his antecedent, should put the right person in the right position. The round peg in the round hole. Leadership is number one. Once we get the leadership at the health sector right, then the programs of the government will be seen to be implemented. And implementing the programs means looking at what the timeline is. What are those ingredients in the program that are beneficial? Of course, every program of government is meant to be beneficial. And we know that there are programs, even the current administration has started, which are beneficial, and those programs must be completed. For example, getting our tertiary health institution well capitalized and funded to perform efficiently. 2, delineating the tiers of government to take care of all the tiers of health care programs. We have the primary health care program, we have the secondary health care program, and we have the tertiary healthcare program. The state governments are all running into tertiary health program. They have no business in that. Even if you have to run tertiary health care program, you must make sure that your secondary and primary health care programs are well efficiently run. The primary health care program should see 75% of the healthcare issues. And if the primary healthcare program is neglected, then we are not going anywhere. Thirdly, we must adequately fund health sector. We have National Health Insurance Authority, which is supposed to be a mandatory health insurance scheme for all Nigerians. This must be keyed into every levels of government, particularly the federal government, must make sure the workforce are keyed into health insurance scheme. Because without a mandatory health insurance scheme, the coverage, which is still abysmally low, will not get wider. And providing a lot of fund into health sector through that means each level, each tiers of government and each level of healthcare must be able to tap into it. A tertiary institution, the teaching hospital, should have no business in taking care of malaria if our primary healthcare levels are well funded.
Absolutely.
And well staffed.
I hear you, Prof. It's a good place to leave it. Be sure that we'll continue with this conversation, and we'll also, bring you on for more, since you seem to have a lot of ideas in this regard that can benefit the incoming administration. Pioneer Provost of the College of Health Sciences, Ahmadu Bello University, former President, Nigerian Medical Association, Professor Mike Ogirima, thank you so much for joining us on the program. Former Vice Chancellor, Redeemers University, Professor Oyewale Tomori, and having a conversation with two professors make me feel like one already. Thank you so much, gentlemen, for joining us on the program.
Thank you. Thank you.
My pleasure.